While there is currently no evidence of widespread community transmission of COVID-19 in Singapore, it is important for us to be prepared. We are putting in additional measures as the situation evolves. Researchers around the world have warned that the world could see many more cases of COVID-19 in the community. Locally, we do expect the number of confirmed cases to increase over time. This is also partly due to the enhanced disease surveillance we have put in place earlier to help us detect the virus early to reduce the risk of further transmission. We are quite concerned that many of our local confirmed cases had remained in the community, and some have gone back to work even when they were ill and even after they had seen a doctor. This is not helpful in our efforts to reduce the risk of community transmission. It is a fact that most patients with respiratory symptoms are not infected with COVID-19. But as an added precautionary measure, the Ministry of Health has given guidance to doctors to provide medical certificates of up to 5 days for patients with respiratory symptoms to stay home so that they can recover, rest and recover. We urge our employers to support our efforts and play their part to stop unwell employees from reporting to work. Our primary care system plays an important role in the detection and management of COVID-19 diseases. Therefore, the Ministry of Health is taking additional measures to focus on our primary care efforts to better detect and manage COVID-19 infections. From 18 February, the Ministry of Health is reactivating the Public Health Preparedness Clinics, or PHPCs, to care for patients with respiratory symptoms, such as fever, cough, sore throat, and running nose. These preparedness clinics are an important line of defense during our public health outbreaks. The activation of these preparedness clinics is not new. Ministry of Health had previously activated them during H1N1 and haze. To encourage those who are ill to seek treatment, these preparedness clinics will provide special subsidies for those diagnosed with respiratory symptoms. Patients with such symptoms can also go to our polyclinics, where the subsidies will also apply. I hope we can work together to fight this disease. If each of us play our role and be socially responsible, we can minimize the risk, reduce the risk of further community transmission.